Hello, my name is Amirreza Ardeshiri, and today I'll be presenting my project on early stage cardiomegaly detection using deep learning. And this presentation is part of the image processing and pattern recognition course. And my goal is to discuss how deep learning models, specifically CNN, can be used for detecting cardiomegaly from X-ray images. Um, Cardiomegaly or an enlarged heart is a serious condition that can lead to complications such as heart failure and even sudden death. Early detection is crucial as it allows for timely intervention and better patient outcomes. In this study, they develop a deep learning model to classify chest X-rays as either normal or indicative of cardiomegaly, aiming to make the diagnostic process faster and more accurate. Before diving into methodology, let's understand what cardiomegaly is. Cardiomegaly refers to the enlargement of the heart, which can be due to various factors like high blood pressure or coronary artery diseases or genetic conditions. A normal heart is about 12 to 13 centimeter in length and weighs between 250 to 300 grams. But with cardiomegaly, it can exceed that 50.5 centimeters and 450 grams. Common symptoms include shortness of breath, irregular heartbeats, and swelling in the legs or abdomen. Chest X-rays are commonly used to detect this condition, but interpreting these images can be time-consuming for radiologists. Previous research has explored different approaches to automate cardiomegaly detection. Common techniques include CNN-based models, attention mapping, and hybrid classical quantum models. However, these methods have limitations. Many studies faced issues with limited data sets, class imbalance, and the lack of real-time processing capabilities. Um, and the approach in this study attempts, in here actually the approach attempts to address these challenges by focusing on a high performance model and robust pre-processing. Image pre-processing plays a crucial role in enhancing X-rays images for analysis. In this study, they use several pre-processing steps. First, they resize images to 224 times 224 pixels to reduce computation, and they then applied BM3D filtering, which effectively reduced noise without compromising image details. Finally, they use CLA, HE, or CLAHI, or contrast limited adaptive histogram equalization to enhance contrasts in low intensity areas, making features more distinguishable for the model. And the data sets here consist of 4,400 chest X-rays images split equally between healthy and cardiomegaly cases. The deep learning model they have used actually is based on convolutional neural networks or CNN, which are ideal for image classification tasks. And they tested four different models. The first one is a custom CNN, Inception, DesNet 169, and ResNet 50. Each model offers a unique architectural benefits. For instance, Inception used mixed convolutional layers. DenseNet 169 used a dense connection to improve feature reuse. And ResNet 50 includes a residual connection to avoid gradients vanishing in deep networks. And let's go over the models in more detail. They use a custom CNN for baseline comparison. And the Inception model, known for its multi-scale feature extraction, achieved high performance but was slightly less accurate than DenseNet 169 and ResNet 50 and actually than DenseNet 169 and ResNet 50. And DenseNet 169 with its 169 layers and dense connections showed actually robust results by reusing features efficiently. Finally, ResNet 50 with its 50-layer structure and residual blocks achieved the highest accuracy and was the best performer in this study. Here are the performance results for each model. As shown, ResNet 50 achieved a perfect 100% accuracy in both training and validation, and 99.8% accuracy in testing. DenseNet 169 was a close second with 99.7% testing accuracy, and actually the custom CNN and Inception also performed well, but didn't reach the level of ResNet 50. These results demonstrate that ResNet 50 is highly reliable for detecting cardiomegaly in chest X-rays. To enhance interpretability, they used a GradCam or gradient weighted class activation mapping to visualize the model's focus areas. GradCam generates heat maps that highlight the most critical regions in an image for the model's decision. In these heat maps, red areas indicate regions that were most influential in predicting cardiomegaly. This visualization tool not only helps verify the model's accuracy, but also aids radiologists in understanding the basis of the model's predictions. Now let's discuss the clinical implications of their model in this study. First, automated detection can lead to faster diagnosis, which is crucial in urgent cases. The high accuracy of ResNet 50 could improve diagnostic reliability, allowing radiologists to focus on complex cases. Early detection of stable signs, as enabled by the model, could lead to earlier treatments, potentially preventing further complications. Additionally, by automating the initial analysis, radiology departments could optimize their workflows, which would ultimately benefit both doctors and patients. While the ResNet 50 model shows great potential, implementing it in clinical practice present challenges actually. For real-world application, the model needs to be integrated with electronic health record system and imaging databases. Clinical validation across diverse populations is essential to ensure consistent performance. And ethical considerations, including the data privacy and algorithmic biases, must be addressed to gain trust in AI-driven diagnostics. Finally, as clinical and data and practices evolve, the model will need continuous improvement and training and retraining. Um, um, and actually, in conclusion, this study shows that deep learning, particularly the ResNet 50 model, can be a powerful tool for early stage cardiomegaly detection with 99.8 testing accuracy. This model demonstrates reliability and has the potential to enhance diagnostic efficiency. And further improvements like multi-class classification for various cardiac conditions could further expand its utility in medical imaging. And integrating this model into clinical workflows could significantly reduce diagnostic time and improve patient outcome.